Assalamu alaikum dear students, welcome to your channel The Anatomy Canvas. In today's class we are going to discuss with the MCQs with their explanation of embryology and histology of the block B. So first MCQ is that the hypaxial muscle precursors form the following muscles, that is infrahyoid body wall and limb muscles, rectus abdominis and the transversus abdominis muscle. So the next new method of classification of the muscles are either they are hypaxial muscle or epaxial. Epaxial mean they are above the axis and hypaxial mean they are below the axis. So muscle which are hypaxial, they will form body wall and limb musculature, and this is the answer. Next question is, which of the following cell is a tissue macrophage? That may be histiocyte, the dust cell, the Langerhans cells, the microglia. So the tissue macrophage is basically the histiocytes which is present in connective tissue below the epidermis and the epithelium. The tubules are invagination of the myofibrils, the sarcolemma, the sarcoplasm and the sarcoplasmic reticulum. So tubules of the skeletal muscles are basically the invagination of the sarcolemma, that is the cell membrane. Edge zone of the sarcomere is an area that contains the thick and the thin filaments, where actin filament and myosins are attached. Where actin filaments are attached, where myosins are attached. So this is the answer, because edge zone is the area where only the myosin filaments are present and is given the name of the edge zone. Concerning the territorial matrix, which of the following statement is correct? So it contains large amount of the sulfated proteoglycan. It contains large amount of type 2 collagen. It surrounds the chondroblast and it surrounds the fibroblast. So basically the territorial matrix is surrounding the chondrocytes, not the chondroblast or the fibroblast, and it is mainly formed of the large amount of the type 2 collagen. So this is the correct option. Next MCQ is, fibrocartilage contains predominantly which type of the collagen? Type 1, type 2, type 3, type 4 or type 6, and the correct option is A, that is type 1. The fibrocartilage is formed by the type 1 fibers, collagen fibers. Next question is, which type of the tissue can be seen in the tracheal ring? That is, it may be elastic cartilage, it may be fibrocartilage, it may be secondary bone or the woven bone. So basically the tracheal ring consists of the hyaline cartilage. Basically it is the hyaline cartilage which is forming the rings of the trachea. A baby is born with the 2 fingers of the hand fused. The doctor tells the parent that this is due to failure of the apoptosis of mesenchyme between perspective digits in the hand plates. The left nipple is displaced and there is complete absence of the pectoralis major muscle. The baby has the following anomaly: the arthrogyroposis, the Becker's muscular dystrophy, micromelia and Poland syndrome. So the Becker's muscular dystrophy is basically muscular degenerations, micromelia in which the limbs are smaller in size, and this is basically the Poland syndrome, which is the correct option. Next MCQ is that the lamellae are always found in which of the following? That is bone marrow, no. The house-shaped lacunae, the secondary bone and the woven bone. Basically the house-shaped lacunae is the place where the osteoclasts are present. The secondary bone mean the mature bone or the compact bone, and woven bone mean immature bone. So lamellae are formed in mature bone, so the secondary bone is the correct option. Next is, development of the limb buds begin in which week of the intra-embryonic period? Very typical question, either 2nd week, 3rd week, 4th week, 5th week or the 6th week. So correct option is the 4th week in which the limb buds appears, and this is the answer. Next is, primordia of the giant develop at 8th week of development from the interzonal mesenchyme. So which type of the following joint is formed after its differentiation into the fibrocartilage? That is the gliding joint, the primary cartilaginous joint, secondary cartilaginous joint, sutural joints and synovial joints. So all the these other are formed by the hyaline cartilage. The only sutural joint which is present in the skull forming the sutures is formed by the fibrocartilage, and this is the correct option. A newborn baby presented to the children's specialist with normal trunk but the short limbs. Examination revealed no mental developmental anomaly and no evidence of other birth defects. Which part of the developing long bone is responsible for the birth defect? That is diaphysis, epiphyseal plate, epiphysis, metaphysis and the pressure epiphysis. So it is basically epiphysis where the endochondral ossification is taking place and which is responsible for lengthening of the bone in the long bones, and if there is a defect in this region it will lead to the short limbs. Somites are developed from the praxial mesoderm after their differentiation into somatomeres. Which of the following part of the somite help in formation of the bone and cartilage of the axial skeleton? So that is either dermatome, dermomyotome, myotome, sclerotome or scleromyotome. So remember, dermatome is responsible for formation of the skin, the dermomyotome collectively forming the skin, and the muscle, the myotome forming the muscle, and this is the sclerotome which is forming the bone and the cartilage of the axial skeleton. So it is the correct option. Which feature is typical of the elastic cartilage? Primary skeleton feature tissue in the fetus, no identifiable perichondrium found in intervertebral disc, most widely distributed cartilage in the body and found in auricle of the outer ear. So this is not the primary skeletal tissue in the fetus, it is the hyaline cartilage which is primary skeletal tissue in the fetus. There is perichondrium is also present in case of elastic cartilage. In intervertebral disc, this is the fibrocartilage which is present. Most widely distributed cartilage in the body is again hyaline cartilage. So the elastic cartilage is found in auricle of the outer ear or the pinna of the ear, and this is the correct option. Next question is that the 28-year-old woman visits the family medicine clinic complaining of loss of sense of smell, nosebleeds, problem with swallowing and hoarseness, and she admits to the social use of the cocaine on regular basis since her college life. The complete examination revealed severe rhinitis with perforation and collapse of the nasal cartilage. So breakdown of the nasal cartilage release collagen fibers primarily of which type? So this is a simple question with the confusing scenario taken from the internal examination of medical college, and just concentrated over here in the stem that the nasal cartilage is basically hyaline in nature and hyaline cartilage is formed by the type 2 collagen fiber. So this is the answer to the question. Next is which steps occurs first in chondrogenesis? That is oppositional growth, the conversion of the chondroblast to chondrocytes, formation of the mesenchymal condensation, interstitial growth, and secretion of collagen-rich and proteoglycan-rich matrix. So in the process of the chondrogenesis, first of all, formation of mesenchymal condensation take place, and this is the answer. Next is in a healthy bone, canaliculi are likely to contain which one of the following? The capillaries, the nerves, the osteocytic process, osteoid or osteocytes in resorption lacunae. So basically canaliculi in the bone contains the processes of the osteocyte, and this is the correct option. In the diaphysis of typical long bone, which one of the following structure is in direct proximity to proximity to trabeculae of the cancellous bone, that is interstitial lamellae, the osteons, Sharpe fiber, inner circumferential lamellae and outer circumferential lamellae. So please remember, interstitial lamellae are present in between the osteons of the compact bone, and osteons are present in compact bone. Sharpe fibers are the type of the fibers which are attached to periosteum. The inner circumferential lamellae is basically facing the spongy or the cancellous bone, and outer circumferential lamellae is present just beneath the periosteum. So inner circumferential lamellae is in relation to cancellous or spongy bone, and this is the answer. Next is, which one of the following most accurately describes the compact bone, that is predominant bone in the epiphysis of the adult long bone, also known as cancellous bone, characterized by presence of osteons, lines the medullary cavity and forms the dipole in the cranial bones. So basically this is characterized by presence of osteon, which is the typical structural unit of the compact bone, and this is the answer. Next is, the flat bone of the skull develops by means of the calvarium ossification, the endochondral ossification, the external ossification, the internal ossification, or intramembranous. So we all know that the flat bones develop by the intramembranous ossification, and this is the correct option. Next is, the paraxial mesoderm around the neural tube give rise to either dermamyotome, the ectoderm, the neural crest, the sclerotome, and the somites. So we all know that the paraxial mesoderm forms the somites around the neural tube, and this is the answer. Next is, bones of the pelvic and the shoulder girdle are from the mesenchymal cells from the general mesoderm, the intermediate, lateral plate, the neural crest, and paraxial. So answer is the paraxial mesoderm, and this is correct option. Dash exerts an inductive influence on limb mesenchyme to initiate the growth and development of the bones. So please remember, some of the questions are taken from internal examination of our medical colleges and medical college, and some are taken from other medical college. So you know this is from our examination, that the options are apical ectodermal ridge, apical limb ridge, apical mesodermal ridge, ectodermal apical ridge, or limb inductor. So we all know this is the apical ectodermal ridge, which exerts an inductive influence on the limb mesenchyme to initiate the growth and development of limb bones. Which of the following statement regarding limb rotation is correct? This is again important MCQ, maybe in your exam as well. So the options, different options are: limb rotation does not affect limb innervation. No. Limb rotation is necessary for correct muscle position. Limb rotates 90 degree in lateral. This is opposite. Upper limb rotates almost 90 degree in medial. This is again opposite. So upper limb rotates before the lower limb, and this is the correct option. Limb bursts are first perceptible during dash week of the development. This is a repeat question, and answer is 4th week. When skeletal muscle shortens in response to stimulation, there is a decrease in width of the A band, in the width of I band, decrease in width of H zone, increase in width of H zone. So answer is, there is decrease in the width of the I band as a result of shortening of the skeletal muscle. Position of the myofibrils between two successive Z discs is called a very simple question. This is the sarcomere. Next is that of the extracellular matrix in following tissue, which would most likely have type 2 collagen? The bone, fibrocartilage, dense irregular connective tissue, dense regular connective tissue, and hyaline. So we all know the hyaline contains the type 2 collagen fiber, and this is the correct option. Next is that which type of fiber has a lot of mitochondria? which type of skeletal fiber basically. So either red fiber or white fiber or intermediate fiber or all of the above or none of the above. So we know that the red fibers contain large number of the mitochondria, and this is the answer. So these are the dark bands. Which are the dark bands? Either A band or I band or H zone or Z disc or M line. So we all know this is the A band, which is also called dark band, and I band is called the light band. Structures that surround the individual muscle fiber is called either endomysium, epimysium, myomysium, perimysium or sarcolemma. So this is the endomysium which surrounds the individual muscle fiber, and this is the answer. Next is, which of the following is found in house-shaped lacunae? Either chondroblast, the chondrocytes, osteoblast, osteoclast or osteocyte. So we all know that osteoclast is one of the cell of the monocyte macrophage lineage. It has lysosomal enzymes which it releases, and because of this it is present in a lacunae called house-shaped lacunae, and this is the answer. Which type of the collagen is found in the compact bone? Type 1, 2, 3, 4 and 6. So we all know that this is the type 1 fiber which is present in compact bone. Which distinguishes cartilages from the other tissue? An important question. The cells are mesenchymal. Cells can be divided by mitosis. Each function in mechanical support. It lacks the blood vessels, and matrix is rich in collagen. All other features resemble the cartilage and connective tissue except that cartilage lacks the blood vessel, and this is the answer. Which of the following is not a component of the developing limb? The mesenchyme, apical ectodermal ridge, neural crest cells, hyaline cartilage and ectoderm. So we know that neural crest cells are not involved in formation of the limb. All other factors are responsible, all other tissues are responsible for formation of the limb. So C is the correct option. What is syndactyly? The syndactyly is either malformation of hand or foot resulting in shortened digits, malformation of hand or foot resulting in fusion of 2 or 1 digit, malformation of hand or foot resulting in extra digits, malformation of hand or foot resulting in absence of long bones, or malformation of hand and foot resulting in lobster's claw deformity. So basically a very simple question. Syndactyly is resulting in fusion of the 2 or more digits, and this is the answer. So next is, which of the following give rise to bones of the face? The cartilaginous neurocranium, the chondrocranium, membranous neurocranium, the precaudal chondrocranium or viscerocranium. So we actually know there are two types of the tissue which are forming the face and the skull. The neurocranium is forming the skull and viscerocranium is forming the bone and cartilages of the face, and this is the answer. So here I complete my today's class. Best of luck for your professional exam, and thank you very much for your attention. Allah Hafiz.